Question number 1. A patient who is receiving a blood transfusion develops symptoms of dyspnea, cough, distended neck veins, hypertension, tachycardia and pulmonary edema. Which of the following is the most likely cause of the patient's symptoms? Options. Option A. Allergic reaction to blood product. B. Sepsis due to contaminated blood. C. Hypovolemia due to excess fluid. D. A hemolytic reaction due to patient-donor mismatch. So here the correct answer is option D. A hemolytic reaction due to patient-donor mismatch. So in a hemolytic reaction that can cause a cascade of symptoms including dyspnea, cough, distended neck veins, hypertension, tachycardia and pulmonary edema is due to the destruction of red blood cells and subsequent release of substances like free hemoglobin and cytokinins, leading to fluid overload and cardiovascular instability. Question number 2. A nurse is caring for 1-year-old child with congestive heart failure. Which nursing goal is appropriate? Options. Option A. Relieving pain. B. Improving myocardial efficiency. C. Maintaining thermoregulation. And D. Promoting oral feeding. So here the right answer is option B. Improving myocardial efficiency. So congestive heart failure in children involves the heart's inability to pump blood effectively, leading to symptoms such as fatigue, difficulty in breathing and poor growth. Improving myocardial efficiency aims to optimize the heart's function and reduce the workload and enhance the cardiac output. So thus elevating the symptoms and promoting better overall health of the baby. So while the other options may also be important aspects of care, improving the myocardial efficiency directly address the underlying conditions of congestive heart failure in this scenario. Question number 3. A primate David client who is at 14 weeks of gestation has been diagnosed with hyperemesis gravidarum. The nurse explains to the client that the condition is related to higher levels of options. Option A. Testosterone, B. Estrogen, C. Aldosterone and D. Progesterone. So here the right answer is option B. Estrogen. In hyperemesis gravidarum, severe nausea and vomiting during the pregnancy is believed to be associated with higher levels of estrogen. The exact cause is not fully understood, but the hormone changes, particularly the elevated levels of estrogen, are thought to be contribute to this condition. Question number 4. A patient diagnosed with post-traumatic stress disorder, which behavioral symptom would be the nurse expect to access in this case? Options. Option A. Ritualistic behavior. B. Hopelessness and helplessness. C. Recurrent distressing flashback. And D. Diminished participation in significant activities. So here the right answer is option C. Recurrent distressing flashbacks. In case of post-traumatic stress disorder, recurrent distressing flashbacks are a prominent behavioral symptom. These flashbacks involve vivid and distressing re-experiences of the traumatic event, significantly impacting the individual daily life. Nurses play a crucial role in assessing and addressing these symptoms, providing support and facilitating access to appropriate treatment modalities to help manage efficiently the PTSD. Question number 5. What is the normal systolic blood pressure of newborn? Options. Option A. 40 to 60. B. 60 to 80. C. 80 to 100. And D. 100 to 120. So here the right answer is option B. 60 to 80. So the normal diastolic blood pressure, that is between 30 to 45, and the newborn breath normally rates from 40 to 60 breaths per minute. Question number 6. The Antenatal clinic nurse was assessing a 32-year-old gravid to para-1 pregnant mother on the fundal height at 36 weeks. What is the expected fundus position? Options. Option A. Umbilicus. B. Xiphoid process. C. Symphysis pubis. And D. Between umbilicus and symphysis pubis. So here the right answer is option B. Xiphoid process. As the pregnancy progresses, the fundal height increases and usually reaches its highest point near the xiphoid process around 36 weeks. After that, it may stabilize or even slightly drop as the fetus descends into the pelvis in preparation for birth. Question number 7. The nurse is teaching nursing students how to provide care to clients with anger management and aggression problems. Which statement made by the nurse is most indicative of effective teaching? Options. Option A. Avoid taking the client's anger personally. B. Defend yourself from the client's anger. C. Take responsibility for the client's anger. And D. Respond firmly to the client to relieve your own stress. So here the right answer is option A. Avoid taking the client's anger personally. So effective teaching in this context involves imparting skills and strategies to nursing students that promote professional and compassionate care for clients with anger management and aggression issues. So by emphasizing the importance of not personalizing the client's anger, the nurse is teaching students to maintain the professional boundary and not internalize or escalate the client's emotions. So this approach fosters empathy, understanding and constructive response to challenging situations, ultimately promoting better outcomes for the client and the healthcare provider. Question number 8. A nurse prepares to administer a vitamin K injection to a full-term infant. The mother wants to know the importance of the injection. Which of the following is the best nurse response to the mother? Options. Option A. Needed for blood clotting to prevent hemorrhage. B. Accelerate the growth and development of infants. C. Helps in maintaining a healthy gut and passage of meconium. And D. Protect the infant from developing severe respiratory distress. So here the right answer is option A. Needed for blood clotting to prevent hemorrhage. The primary purpose of administering vitamin K to newborn is to support blood clotting and prevent hemorrhagic disease of the newborn. Vitamin K is essential for the synthesis of clotting factors in the liver, and newborns are born with low levels of vitamin K, making them susceptible to bleeding disorders. Question number 9. A pregnant woman who is 36 weeks of gestation was admitted to the antenatal ward for obstetricia after being involved in a car accident. She refused when the nurse tried to touch her abdomen to perform an abdominal examination, saying it is painful. She also presents with mild vaginal bleeding. Which of the following is the most appropriate diagnosis? Options. Option A. Placenta previa. B. Tubal pregnancy. C. Abruptio placenta. And D. Inevitable abortion. So here the right answer is option C. Abruptio placenta. Abruptio placenta is characterized by the premature separation of the placenta from the uterine wall before the baby is delivered. Symptoms can include abdominal pain, which may be severe, and vaginal bleeding is also present. The abdominal pain in abruptio placenta can be described as sudden and severe, which aligns with the woman's complaints of pain. While her abdomen is touched by the nurse, she is telling that complains that pain is present. The mild vaginal bleeding is also consistent with the diagnosis. It is important for the woman to receive prompt medical attention due to the potential risk to both her and the fetus. Question number 10. A 4-month-old baby breastfeeding is having colic. Which of the following suggestions should the nurse give to the mother to relieve the colic? Options. Option A. Allow the infant to hold on to his favorite toy. B. Place the infant prone over a covered hot water bottle. C. Encourage the mother to eat more milk product. D. Give a warm bath and place in tender birth position. So here the right answer is option D. Give a warm bath and place in tender birth position. So a warm bath can help to relieve or relax the baby's muscles and provide comfort. Placing the baby in a tender birth position may also help to alleviate discomfort associated with colic. Question number 11. An inpatient has an order for heparin sodium 10,000 units to be given subcutaneously. The heparin sodium in stock is 40,000 units per ml. Which is the correct amount of heparin sodium to give this patient? Options. Option A. 0.025 ml. B. 0.25 ml. C. 2.5 ml. And D. 25 ml. So here the right answer is option B. 0.25 ml. To determine the correct amount of heparin sodium to give to the patient, we can use the formula dose in ml, ordered dose divided by stock concentration, or dose is available. So given ordered dose, that is 10,000 unit, and the stock concentration or dose in available or in hand, that is 40,000 units per ml, and so we can calculate the dose, that is 10,000 divided by 40,000. We will get the answer to 0.25 ml.